Hello, how are you, everyone? Welcome again to today's iCON forum, our online webinar, Take Charge of Your Health, Living Well Together with Diabetes. I am Barbara Ho. I am the Chief Nursing Officer of iCON Chinese Division and your host today. Today's topic, the theme, again, has to do with diabetes. And iCON is the office is situated on the traditional, ancestral, and unceded territory of the Musqueam, Squamish, and Tsleil-Waututh peoples. We would also like to acknowledge that you are joining us today from many places, near and far, and acknowledge the traditional owners and caretakers of those lands. iCON is an initiative of the UBC Faculty of Medicine. Let's start with Digital Emergency Medicine Initiative. The main purposes are through organizing health seminars, workshops, and using web technology, we can help multicultural public to know more about prevention of diseases. And also for those who we can instill knowledge for using digital technology to manage your chronic diseases. We hope that we can give you accurate and reliable information for everyone to share. We hope that not only local public can share with this, we hope that through the webinars, we can also spread the knowledge to far and remote places so that everyone can strive to improve our physical health.
We would like to present Dr. Charmaine Ma. And so, Dr. Ma.
How are you? Thank you, Barbara. Yes, thank you, everyone, especially the iCON, for having the opportunity for me to share with all of you about diabetes and how it affects our health. But as a family practitioner, for sure, I see a lot of diabetes patients, and here there are many people who probably are familiar with diabetes, or maybe you have family members who have encountered the issues with diabetes. Barbara has told us that, in Canada, it affects a lot of people inside the province and outside the province. Every year, new people get diagnosed with diabetes. As well as a family physician, maybe out of every 10 patients, there's one who has diabetes. Actually, those who have pre-diabetes, the numbers are larger. So I can tell you some basic information about diabetes. I know that a lot of people are already familiar with some of the knowledge, some of the information. So be patient with me, because what follows, there will be a lot of senior specialists who will one by one explore more about diabetes with us. So today, I hope that I can, within the next quarter of an hour or so, to tell you what is blood sugar. We often hear blood sugar, but what about the different levels of blood sugar? Actually, blood sugar, what kind of impact does it have on our body? So there are actually many types of diabetes. You may probably have heard of pre-diabetes, diabetes type 1, type 2, and gestational diabetes. And some of them even affect children. Some of them affect pregnant women. Some of them affect just adults. So I will share this information with you. And I also will tell you about the risks as well as signs and symptoms. And I will also tell you about what types of different treatments for diabetes with medications or other methods. And at last, I will talk to you about if you realize that you have diabetes, if you don't do anything, if you don't treat it, what will happen in the long term. First of all, I want to talk about blood sugar and our body. I know that I like to use graphics to present my talk. So what kind of functions does blood sugar have on our body? So you can see that on the right side, there's a food factory. So actually every day, everything that we eat into our body, we disintegrate into glucose, and then it supplies to this little circle that's on the left side, which is the cell. And a lot of the bodily functions need the cells, so it needs sugar. So we have to have some sugar. But how do we bring the glucose into the cells? So what it does is what the pancreas creates, that's the insulin. Insulin what helps us bring into our different cells those glucose. And in this graphic, you can see that it's very important, because in any part of this cycle, if something should happen, then you will suffer different types of diabetes. I've talked about different types of diabetes before. So they are prediabetes, type 1 diabetes, type 2 diabetes, and gestational diabetes. Now, first of all, I want to tell you what type 1 diabetes is. Type 1 diabetes, probably you are not so familiar, but some of you have heard of it, and some children even have that type of diabetes. So what it is it's a
Immune system.
immunological malfunction. So those who suffer from type 1 diabetes would usually be diagnosed before the age of 30. And because of malfunction of the immunological system, our insulin that's produced by the body has been damaged and would stop producing insulin. And then you look back at the graphic, you don't have those little people anymore. So no matter how much how much sugar you take in, it doesn't go into the cells. So this is a fatal disease. So especially in the 18th century or before that, a lot of the children, because they had this, and they could not produce insulin, and they stopped functioning and they died. And fortunately, in 1921, here in Canada and Toronto, there were two Dr. Spanting and Beth, those two doctors. They discovered the ways to extract insulin and then share this with the world. And they won Nobel Prizes for that, because of this type of insulin that saved a lot of people's lives. So if you have type 1 diabetes, you have to inject insulin on a long-term basis, as well as take good care of your health and keep good balanced diet and exercise, and test your blood sugar regularly. Maybe you are anxious because today our main protagonist is type 2 diabetes, because 90% of the people have type 2 diabetes, for those who have diabetes. So type 2 diabetes happen for those who are often after 40, but since around the world there are people who tend to be obese, and we cannot control our diet, so blood sugar level tends to be higher. So they realize that it's getting more and more common. And this is not something that happened overnight, because our body gradually lose all the mechanisms, start malfunctioning, and what we produce in our body, the insulin is less, so the sensitivity has also decreased. Some people don't have very obvious functions. Like I said, it doesn't happen overnight. Maybe it happens over 5 years, 10 years, and then gradually you lose those functions. So as a family doctor, usually I would recommend after 40, then you should check your blood sugar regularly. And if we want to control type 2 diabetes, first of all, you have to have a balanced diet and a healthy lifestyle. Exercise, of course, you have to pay attention to that. And then you also have the periodic blood sugar check. And you may also need some medications. In terms of medications, we will have specialists to share different types of treatment methods with us. I'm sure you know that there are pills you can take, or even If it's serious, you need pills plus injections and other medications and insulin to control your diabetes. And you've heard that after someone sees that family doctor, how was the blood test? It's okay. I just passed. So this may be someone who is having pre-diabetes. So you think you are okay, but it takes a long time to be diagnosed with type 2 diabetes. But if for pre-diabetes, it means that your body starts to malfunction, and everyone in 3 have pre-diabetes. So look around you. So here we have, I don't want to tell you how many, but many people don't know they have diabetes, pre-diabetes. And so because it gradually goes kaput. And if you have pre-diabetes, of course, you gradually develop into pre-diabetes, and so the risk for stroke and heart disease will be higher. So we want to maintain a good health, a balanced diet and exercise, because we realize that with a good lifestyle, whether it's diet or you can talk to a dietitian to find out more about diabetes. And so this will reverse the situation. So if the doctor tells you, well, you are into this stage, in the pre-diabetes stage, you should pay attention. So if you are alert and you're obedient and pay attention to that, it's possible to reverse it and not let it deteriorate into type 2 diabetes. So I believe that most of you, when you go have your blood test, you like to ask your doctor, so what kind of numbers do I have to remember? There are many numbers, actually. First of all, every country has different units that they use. Here in Canada, we use millimoles per liter. So how many millimoles is there in 1 liter? So in UK, USA, they may have different units. So just don't try to remember these numbers. Only in Canada, when you talk to doctors, they give you these numbers. Now on the right, lower right corner, you see that the 7-Eleven, this logo, everybody knows. So why do I choose 7-Eleven logo? Because other numbers are difficult to remember. So 7-Eleven is easy to remember. So what we use is fasting blood glucose. So after about 6 to 8 hours after you eat, we look at the blood sugar level. If it's over 7, okay, like 7-Eleven, so that means you have diabetes. Another index we have to look at is after eating, your blood glucose. So you poke your finger, or if after you have drunk some glucose, you can also have blood tests, sugar level test. So that shows you how your body can disintegrate blood sugars, and how your body can use insulin as well as to absorb the blood sugar. If the use of that is insufficient, then our cells cannot absorb the sugar, and then the sugar level will tend to be high. And after a meal, or after we've drunk glucose for more than 2 hours, if it's over 11, then it also represents diabetes. That's why 7-Eleven. So, okay, 7 on empty stomach and 11 on a full stomach. So, but just don't be too panicked if you poke your finger and you find out it's 11, because after you have tested once, the doctor may have other recommendations. If you have pre-diabetes, the doctor can tell you how you can treat it. And some people want to know that the indices actually you test it every 3 months. So this is something called A1C. That means that there's protein in our blood that is associated with sugar. So every 3 months, we have to test our hemoglobin. So if in the 3 months, the hemoglobin index A1C you can tell that in the past 3 months, your blood sugar level. So somebody may say that, oh, on an empty stomach after I have fasted for more than 10 hours, that means that I can lower blood sugar level, but actually cheating yourself, because when you look at the 3-month blood sugar level, we can see within those 3 months, there may have been times that you have gone over the standard. So the standard is 6 to 6.4. If it's over 6.5, that means you have diabetes. Again, 7-11 means fasting sugar, fasting blood sugar, 7, full stomach 11. If you have any questions, you should talk to your family doctor. So finally, I want to tell you about gestational diabetes. So gestational diabetes is when a woman is pregnant, the risks are high. Every pregnant woman in BC with between the 24 to 28 week pregnancy, that's in the midterm of the gestation, the doctor will prescribe a blood work test. And so to find out that if it's the functions of producing insulin have deteriorated. First of all, the premises is based on that a woman does not have diabetes. That means before a woman is pregnant, she never had diabetes. But if a pregnant woman during her pregnancy, if she does not control her blood sugar, then it may cause the baby, it may create risk for the baby. So these risks will also increase. So I suggest that pregnant women should listen to their doctor during the midterm of their pregnancy. They should also have a blood test. And then after they gave birth, and the symptoms will decrease. So it means that during the pregnancy, the blood sugar level will increase, but after they have given birth, you can see that maybe in future, the risk of having type 2 diabetes will also increase, meaning that she herself, her insulin, pancreatic function has deteriorated. So if someone who has diabetes 2, type 2 diabetes before, you should tell them that after they have given birth, they must talk to the doctor as soon as possible. The next thing that I want to talk about is a treatment for diabetes. So I like I said, I like to use graphics. So what I want to tell you is that actually type 2 diabetes, what kinds of treatments there are. So like I said before, you should improve your diet, a balanced diet. So if you keep increasing your blood sugar when you eat, when your mouth doesn't stop eating, so that's bad. So we have to choose foods that have good level of sugar contents. The other thing is be persistent in doing exercise and keep your weight in control. I've said that already, that there is a problem with obesity on the global scale. So because people tend to do exercise less, they spend more time on the computer, in front of the computer. So we should also pay attention to that. And there are medications to control blood sugar. Later on, we will have doctors who will talk to us one by one what kind of medications, whether they are taken not orally or injected. All these will affect our glucose, our pancreas, and as well as our insulin, even our muscles. They may be sensitive to the sugar level in the insulin. Finally, you should also try to self-manage through different methods. In other words, you should increase your knowledge. So I thank you all for attending this self-management, the desire and the hope to self-manage, and that's why you attended this. You're attending this seminar. So because you want to know about. Want to know more about this, and then you can treat yourself and prevent that better. Finally, I wanted to tell you something about if you know that you have diabetes, but you say, that's all right, it's just a bit over excess of blood, what harm does it do on me? Well, I can tell you, for example, it's just like a faucet, a tap in our water, in our home. If you use it long, then there must be some rust, some stains in our blood levels. So there are 3 highs in Chinese: blood pressure, blood sugar, and lipids. All this, if you do not control it on a long-term basis, it will affect your blood vessels, especially if you have diabetes. For decades, on a long-term basis, it's like water pipes. They have rust. They have rusty water. So if it keeps on a long-term basis, then it will be damaged. So if that happens to our body, because our body, we have a lot of capillary vessels which supplies blood. So in our brain, if something happens, if it's clogged, then we may have a stroke. If that goes to our eyes, maybe if our retina has problems, then we will have vision problems. So for those who have type 2 diabetes, we will every year ask them to check their eyes. As far as cardiovascular problems, so this may happen if it's clogged because our kidney has a lot of capillary vessels, and if we do not control our diabetes well, we will have kidney disease. Finally, it's our nervous system. And you may have heard, maybe, someone has diabetes. It's been a long time.